Good afternoon. I'm Dr. Bohsali. I'm one of the orthopedic surgeons at the Beaches Division. I have been in practice for approximately 2 decades. I am a fellowship-trained board-certified orthopedic surgeon with specific skill set in shoulder and elbow reconstruction. And what that means is that I have additional skills and expertise in addressing certain pathologic conditions of the shoulder and the elbow region. I have essentially both a fracture-based and elective practice. And that involves my ability to manage folks who have acute injuries, but also those that are more chronic in nature, meaning those types of injuries that have accumulated over time. The example that I would give would be somebody who played sports many years ago as an adolescent, and now father or mother time has unfortunately caught up to them. So the hallmark of rotator cuff tear symptoms are pain, typically at night, difficulty laying on that affected side, usually pain that does not respond to activity modification, meaning you've kind of stopped doing your sport-specific activities, or maybe you've reduced your responsibilities at work. And let's say those symptoms persist beyond a 4 to 6 week time frame. Typically, that indicates some type of injury to your rotator cuff. Again, most rotator cuff tears are not traumatic in nature, meaning they usually develop over the stresses that are placed on the shoulder over time with certain activities, particularly those that require overhead motion. And again, those symptoms can be mild, but can also be fairly severe. And most people, in my experience, and over the 20 years of doing this, will usually seek care when their sleep is disturbed. The things that we typically try to employ before considering surgery for a symptomatic rotator cuff tear, meaning a tear that's bothersome, that's affecting your daily routine, your ability to remain independent, whether your activities are living, meaning hygiene care type of activities. Those folks, we usually try simple things, whether it's the use of medications over the counter to prescription anti-inflammatory medications. Sometimes we use physical therapy under the supervision of our well-educated and experienced physical therapists. Sometimes we do injections, and those can be cortisone-based. And that's not curative by any stretch of the imagination, but it can sometimes reduce your symptoms so that you can sleep and maybe even participate in a physical therapy program. If those types of treatment options don't work for you, and assuming you've had an MRI, which is a test that looks at the soft tissues in your shoulder, indicating that you have a tear, then we start having additional conversations to how to fix the problem. We do know that the natural history of rotator cuff tears is such that they get bigger with time. They don't heal on their own. So that's something very important to understand, is that no matter what specific type of treatment option you're offered, if you have a tear of your tendon that's off the bone or somewhere in the tendon area, that will not regenerate. It doesn't matter what type of injection you use, whether it's cortisone-based, PRP, stem cells, those types of things will not facilitate healing of the rotator cuff tendon tear. If you have a tear of the rotator cuff that's either atraumatic, meaning not caused by trauma, or traumatic, there are ways to fix that in a manner that basically minimizes the risk to the healthy tissues, and that's called an arthroscopy, where we basically use a camera and small incisions and specific instrumentation to do the repair. That is typically a procedure that's done as an outpatient procedure that is done under a general anesthetic in conjunction with a nerve block that the anesthesiologist performs to numb your arm temporarily. As far as the recuperation from the type of surgery, most folks will be immobilized for a period of time, usually 4 weeks. With my patients, we typically start you on physical therapy after that time frame, and the expected recovery with that particular procedure is about 4 to 6 months to getting back to what we would consider to be unrestricted activities. There are some scenarios where the pain is so severe and the dysfunction is so significant that you're doing a different type of procedure to manage that person's rotator cuff related issue. And one of the procedures that's been around now since 2004/2005 is something called the reverse shoulder replacement. It is a reverse ball and socket design type of joint replacement of the shoulder. And the way that it works is effectively you are changing the mechanics of the shoulder, and you are using your deltoid muscle, which is the big muscle in the shoulder, to generate function that the rotator cuff used to do. Now, the caveat to that is that even though that procedure provides great pain control, at the end of the day, it does not normalize your shoulder function. So that's a common question that my patients ask me, and we always believe in transparency and truth. And at the end of the day, You will be better, but you won't be perfect. There are certain folks who need to be what we call optimized before surgery. What I mean by that is if, for example, if you have diabetes, if you're a smoker, if you have any chronic health conditions, if you have kidney issues, those all have a negative impact in terms of your healing process. And so your surgeon will probably have a conversation with you about how to make sure that you're in the best shape possible when you have that surgery, so that we can not necessarily guarantee that the tendon heals with surgery, but maximize your body's ability to heal that repair site. With rotator cuff tears, that even if they're surgically repaired, even in the best of hands, that about 30 to 40% of those will recur or come back again at around a 3 to 5 year period. So that doesn't necessarily mean that those folks are having debilitated pain or dysfunction, but if you follow folks over that time frame, even with the best technology, the best implants, the best techniques that we have, and even if we maximize our patient's ability to heal, that there are a percentage of folks who will not. And then there are therefore other options down the road that can be considered to address that problem. If the MRI indicates that the tear has come back, they may also reflect the fact that the tendon itself has retracted or pulled away, very far away from its normal attachment site. And just as important, and this is something that also affects what we can do to fix the problem, if the muscle tissue of your rotator cuff has shrunk or contracted or become what we call atrophic, and more importantly, has it filled with fatty tissue, and that happens with chronic tears, that means that that person who has those changes cannot have another rotator cuff repair. And so the options to address those types of tears are several-fold. You can arthroscopically put in a balloon spacer that pushes the ball of your shoulder joint down and again changes the mechanics, but that's a temporary solution and not a permanent one. There are some scenarios where you can use grafts to span the defect. At the end of the day, those grafts do not restore normal function. You are essentially using tissue to act as a, quote, check rein to hold the position of the head so that you can raise the arm. So there, again, you're trying to stabilize the ball of the shoulder so that it can raise in a way that makes your arm functional. You can do what's called a reverse shoulder replacement, where we put in a joint replacement where the ball and the socket are on the opposite sides of the joint. And again, that is changing the mechanics of the shoulder so that you can raise the arm. It's not going to normalize your shoulder function, but it will make you functional, and it will also address your pain symptoms. For those of you who are struggling with shoulder pain, who are having challenges doing their daily routine, including hygiene care, for those folks who can't sleep at night, it would make reasonable sense to seek expert care at JOI, and certainly any one of us can assist you in resolving those issues. I'm stationed at the JOI Beaches Division, and we'll be happy to take care of you.